Did you know that pregnant women are more likely to have mouth ulcers than if you're not pregnant? In today's video, we're going to cover the topic of mouth ulcers, also known as canker sores, in pregnancy. Let's get into it. First things first, let's talk about what mouth ulcers are. These are small painful sores that develop on the inside of the mouth, including on the inside of your cheeks, the gums, the tongue, the roof of your mouth, and on the inside of the lips. They can be really uncomfortable, painful, and irritating, especially during pregnancy. They're not contagious, so that just means it can't spread to anyone else. White, yellow, or greyish appearance with a red border, painful sores inside the mouth, discomfort while eating or drinking. There are three main reasons why mouth ulcers are more common during pregnancy. One is hormonal changes in pregnancy. During pregnancy, our body produces more hormones such as progesterone and estrogen, and this can cause a hormone imbalance. Increased stress on the body can also lead to increased sensitivity and make you more prone to getting a mouth ulcer. Number 2, a weakened immune system. During pregnancy, our immune systems can weaken, which can make us more susceptible to mouth ulcers. Number 3, nutritional deficiencies. During pregnancy, there's a higher nutritional requirement as these nutrients such as iron are needed to feed the growing baby. Nutritional deficiencies are more likely to cause mouth ulcers. Other non-pregnancy related causes include accidentally biting the inside of the cheek, anything abrasive to the mouth such as poorly fitted dentures, braces, sharp foods, or a sharp tooth. Stress and anxiety, eating certain foods. Some foods known to exacerbate ulcers include chocolate, spicy foods, coffee, citrus foods, cheese, tomatoes, and wheat flour. Toothpaste containing sodium lauryl sulfate. If you've just recently stopped smoking, when you first stop smoking, you might start to develop mouth ulcers. Certain medications, certain medical conditions, and nutritional deficiencies, particularly B12, iron, zinc, and folate. Now let's go through some home remedies that may help to relieve and manage your mouth ulcers. Number 1, maintain good oral hygiene. Brush your teeth gently and use a soft bristled toothbrush. Number 2, avoid spicy and acidic foods as these can exacerbate the pain. Number 3, rinse your mouth with warm salt water. Add half a teaspoon of salt to a cup of warm water. Take in a mouthful and hold it in your mouth for a few minutes and then make sure to spit it out. This will help to heal the ulcers and reduce inflammation and bacteria in the mouth. Tip number 4, stay hydrated. This will help to keep your mouth moist and prevent further irritation. Now, if you've tried the home remedies and they still haven't worked, then it might be time to try some over-the-counter treatments. A safe and effective treatment is to use a non-medicated oral paste such as Orabase. This contains gelatin, pectin, and sodium carboxymethylcellulose. Apply it by dabbing it to the area. Make sure not to rub it in too much. This forms a thin layer over the mouth ulcer to protect it and allow it to heal. You can reapply it several times a day when it starts to come off. It's best to apply it after you've had your food and drink so it doesn't wash it away. This is safe to use in pregnancy. If the ulcers are in the back of the mouth or in hard to reach areas, you can try an alcohol-free mouthwash. These mouthwashes can help to reduce the amount of bacteria in the mouth, which can help it to heal and prevent infection. Avoid alcohol-based mouthwashes as these can cause burning and irritation to the mouth ulcer. Although most of the mouth ulcer gels are unlikely to be absorbed in the body, it's better to avoid gels containing salicylates and anti-inflammatories such as benzodiazepine during pregnancy. If you do want to use these, make sure you speak to your healthcare professional first. If you still have a lot of pain, you can take an oral analgesic such as paracetamol. This is safe to use during pregnancy. Make sure to avoid any anti-inflammatories such as ibuprofen and aspirin during pregnancy. Whilst mouth ulcers are usually harmless and resolve on their own, it's important to know when to seek medical advice. The ulcers are unusually large, persist more than 2 weeks, are accompanied by a severe fever. If you take any medications or have any medical conditions, then make sure you speak to your healthcare provider. Prevention is always better than treatment. To reduce your risk of developing mouth ulcers during pregnancy, let's try these 5 prevention tips. Tip number 1, manage your stress levels. You can do this by making sure you get plenty of rest and try some relaxation techniques. Tip number 2, maintain a balanced diet. It's especially important during pregnancy to maintain a balanced diet. If you do have any nutritional deficiencies, make sure to correct these by taking the relevant supplements. Speak to your healthcare provider. Tip number 3, use a soft bristled toothbrush to avoid damaging the lining of your mouth. Tip number 4, avoid spicy foods and anything that can irritate the inside of the mouth, such as acidic foods. Tip number 5, stay hydrated. This can help to keep your mouth moist and prevent irritation. So that comes to the end of our video on mouth ulcers in pregnancy. I hope you found some useful information to help you manage your mouth ulcers. If you found this video helpful, please give it a thumbs up and consider subscribing. Thanks for watching and we'll see you next time. Bye!